Ever wondered how to rejuvenate your eyes? Today, I will talk to you about different rejuvenation techniques, the different surgeries, and what we can do to bring back that youthful, refreshed look. Eyelid surgery is one of the most impactful surgeries you can have for your appearance and your function. Think about the area around your eyes. It is the thinnest skin on the body. So what that means is it's going to show changes before anything else. So when we talk, we look at people's eyes first, then we go to their mouth, and we naturally kind of go back and forth. So when the eyelids start to change, it affects how you look and unfortunately how people perceive you. It's the old saying, don't judge a book by its cover. I like to say it should be, don't only judge a book by its cover, because it's natural to judge a book by its cover and everybody does that. So if you're thinking about maybe your eyelids don't look as youthful, as rested as they used to, there's a lot of factors to think about. Let's start at the top. If you look at your upper lids and you have fullness in the lateral part, which is the outer part towards your ear, a lot of times that's not your eyelid, it's your brow that's drooping down. So think about it as a curtain rod and a curtain. You have to have a certain relationship between the two to have your best appearance. So the first thing we look at is the brow a component? Let's say the brow is a component. Then we talk about how you can repair a brow, and you can find that on other videos. But let's say the brow doesn't need repair. Then we have the upper eyelid. The upper eyelid can be deflated, meaning you've lost volume, you've lost a lot of fat, maybe you've lost a lot of weight. It can also be drooping, what we call ptosis. Just like lots of things on your face and body can droop, so can your eyelids. So then we have to tighten a muscle. But the important thing to think about is you need an accurate diagnosis to get your best treatment. Fortunately, I'm an ophthalmologist as well as a plastic surgery, so I'm very familiar with all those different types of changes that can affect your eyes. The thing that I always try to do is take everything from the inside out approach. And what I mean by that is you don't need to have an outside incision where you can see a scar usually. If we're going to put volume in the upper lid, if we're going to tighten the muscles, we can do all of that from the inside. Then we can laser the outside to tighten the skin. I mean, if you just think about it with logic, it's not like your skin all of a sudden started to grow and expand and you have 10 more inches than you used to. It's just that you've lost the integrity of that skin. So it means you need volume and you need to have the surface of the skin tightened back to its original form. It would be like if you blew up a balloon and you let all the air out. You know how that rubber's all stretched out and changed? Well, if you had the ability to do a laser and you could make it just like a brand new balloon that's tighter and smoother, that's what a laser does to the eyelids. So let's move down to the lower eyelids. Now, what connects the upper and lower eyelids is the inner and outer corner called the canthus. That's another stability factor, just like the brow. If your canthus is not in the right position, it's going to affect your lower eyelid. That's very analogous to a hammock. If you have a beautiful, sturdy hammock, but it's gotten loose, you've got to go over to that tree, tighten it a couple links, then you have a nice looking hammock. The lower eyelid's the same way. So the first thing we look at is canthal tendons. And you have to be very knowledgeable in this area to even know where those tendons are and how to operate on them. So the lower eyelid is either volume changes from puffy fat or its skin integrity changes. When you start to have what everybody calls bags, that's because you normally have fatty tissue in your orbit around your eyes. Think of it like God made a protective airbag. That's what it is. You have these little airbags around your eye. As the tissue and what's called the septum gets loose, that will move forward, giving you bags. When you get bags in the lower eyelid, you usually lose volume in the upper eyelid. And then you start to look gaunt in the upper eyelid. It's all related, so you've got to know where to put the fat, where not to put the fat. I try to never remove fat unless it's absolutely necessary. And the reason is, I call it God's gold. It's supposed to be there. Think about why a child looks so good and their eyes are so beautiful. It's because of volume. They have that supple, nice, full look. That's what you want in your eyelids. So you need all that volume. The other thing you get is as your cheek area sags, you start to see your bony orbital rim. So if you have that little indentation, almost like a mini valley under your bags, that's because your cheek has moved down and you're exposing the orbital rim. You can reach up and feel it yourself and you'll see exactly what I'm talking about. So just like sometimes we have to do something to the brow to make the upper lid look good, the same is analogous. We've got to lift the cheek to make the lower eyelid look proper and look youthful. So sometimes we'll do eyelid surgery and cheek lift surgery at the exact same time. My approach, again, is an inside-out approach. I don't want to put scars underneath the lashes, in the corners where you talk to people and you've got different scars. So I want everything hidden. So I'll make a small access point over in the temple and I'll dissect down so there's no scar. Sometimes I'll go behind the eyelid and so there's no scar on the outside. And if it's real severe, I'll make a little incision inside the mouth at the gum line. So that allows me full access to that area. So we can rejuvenate the brow, the upper lid, the lower lid, the cheek, and the tendon or the corners of the eye. Now, speaking of corners, y'all probably have seen the so-called fox eyes, where people are exaggerating the canthal tilt and they're making that outer corner very high. All the science, all the studies show that the outer corner should be about 1.5 millimeters to 2 millimeters above the inner corner. When you're seeing the fox eyes and people are doing that, they're putting it about 10 to 12 millimeters higher, which is very unnatural. And I think that as time goes by, it's not going to age very well. So my advice would be, if you want that fox eye look, do it mildly, don't do it extreme. So as far as investment and pricing, I put all of that on my website, oculusplasticsurgery.com. And the reason I do that is I want full transparency. I don't want people to guess. You might come in and say, wow, I thought I just needed a little fat removed, but you didn't realize your cheek had fallen down. Or you're thinking about your upper lid, but you didn't realize your brow had fallen down. Part of it is education, part of it is diagnosis. But the one thing you don't want to be surprised about is this even in the ballpark of what I want to invest in myself? So fortunately, I'll leave you with this thought. There are ways, just like you buy your house, and most people do not pay full cash for their house. They get some type of a loan, and as long as they keep up with it, it's a great investment. Surgery on yourself can be looked at the same way. We've got plans where you can have interest-only payments. These plans are fantastic because there is no interest for the first 18 months. You're only paying a premium, but after that period of time, there is high interest like a credit card. So there's lots of ways we can help you. So think about upper, lower, and brow, and if you have any further questions, please reach out to me.